Hello and welcome to this presentation on SPOT, Spine Posture Optimization and Training, a program designed to coach PE coaches and certify them in helping identify students that might have spine or other postural related problems early on. My name is Marian Podolanu. I'm the founder of FitPro Alliance, and I've dedicated my career to the integration of the healthcare system and the fitness field. I've been in the industry for more than 21 years, and a vast majority of those years I've been an educator, teaching courses and workshops in many countries around the world. I'm also a clinical orthopedic manual therapist and a Schroth therapist as well. And FitPro Alliance is the institute through which we bring this vision to life. But more on that later. Now, let's dive into what SPOT is about and how we can collaborate. What are the vehicles we can use to bring this vision to life? And at the end, I'll introduce a little bit more what FitPro Alliance is if you want to get involved. To start with, I wanted to showcase a few cases that clearly show how our methodologies can impact the lives of many. And the elderly are actually the most difficult population to work with because of the complications from a health standpoint, compliance, their ability to recover, sensitivity to pain, etc. Here we see clearly how a lady has gotten to the point where she can walk without a cane, even though she used to work with a cane. But the benefits don't extend just to the elderly. Here we see an 18-year-old who came to us for increasing his muscle mass. However, he didn't realize that his overall spine posture was suboptimal. He is hyperkyphotic. And here we see how we went from the left side, where we see this narrow, small curvature in the lower back and this big curvature in the upper back and neck, and how that progressed to a more upright posture with a bigger curvature in the lower back, a lesser curvature in the spine, and a better curvature in the neck. And this will translate to better quality of movement overall and better health. So here are some insights for us to consider as we move forward. Postural dysfunctions do not come in a vacuum. They impact our day-to-day life, our health, and often are the consequences of certain movement habits we keep practicing over and over again as children or young adults or later on in life. The interesting part is that most clients who we've come across in the last 6 years of practice are not aware that they have postural distortions. In all of our adult scoliosis and hyperkyphosis, the hunchback posture, all of these cases have not been diagnosed until they were 16 years old or older. And that is a concern because the diagnosis can be established a lot earlier in life, and the prevention methods would have been more impactful. And so, that being the case, movement, exercise, and fitness professionals must have a thorough understanding of spine posture optimization and training and other postural distortions and how to address them, because so many people actually have these postural distortions. Unfortunately, that is not the case today. And that is what we must change. Okay? Moving on. What is SPOT? Spine Posture Optimization and Training is a certification program for PE teachers, physical education teachers, fitness and movement professionals. Its curriculum is based on the Schroth therapy curriculum and our integrated functional fitness framework. The Schroth scope of practice is made for physiotherapists and therapists to help correct scoliosis-like postures, as we see here. SPOT Level 1 practitioners will be able to perform screening, postural screening, which is not diagnosis. I have to emphasize this, because based on that screen, we identify a possible risk, and so then we refer these flagged cases for medical diagnosis. They have an educational role within their school community to help both staff and parents grasp the concept a little bit more and make sure that they can support their young ones through these phases, and more importantly, implement indications and contraindications in the school environment. So, for example, if a young student has scoliosis or a hunchback, there are certain activities that perhaps will increase the severity of this postural distortion and others that may help it. Knowing the difference is very important. We want to ensure we maintain accurate record keeping and reporting. It's important for both tracking the well-being of the students and see how we can improve it year on year. Finally, this educational program takes about a month, and it has online study materials and 2 days of live practical training and then examination. Now, the examination includes both a theoretical component and a practical component. But this is just one component of the program. I have to emphasize this. And in the document attached with this video, you will find far more detail of what we include specific to your circumstances. So the big question has been, should we even include screening in a school curriculum? Is this going to bring a great deal of benefit? Many countries around the world have gone back and forth on this question. And as we have learned more and research has advanced, we've came to the clear conclusion that yes, we need school screening programs. It is a must. It has reported that the decision not to implement screening due to cost-effectiveness concern is based on an outdated assumption, originally derived from an early study that surgery is the only proven treatment option. In other words, in the past, what was the main defining criteria was, okay, so let's say you prevented, you identified, what can you do about it anyway? And in the past, surgery was the only outcome. That is not the case today. As you saw earlier when we spoke about Schroth, there are many non-surgical options through exercise and training. And hopefully, as people engage with these methods, the degenerative process of these conditions can be halted and even reversed. However, as noted by Haves in 2003, the studies did not provide a scientifically justified basis for the conclusion of not screening. Today, evidence demonstrates that signs and symptoms of scoliosis and other postural deformities, by the way, can be significantly improved through intensive inpatient exercise programs. In other words, guided exercise programs. Additionally, this is not a revolutionary idea. They have been done around the world, and there are many screening programs in countries like Japan, China, Greece, and many others where school screening has been implemented and has led to great results and outcomes. So what do we know is that research shows that 3 to 13% of children, depending on demographics, activities of daily living, and societal constraints, will have scoliosis. And if a parent were to ask, what is scoliosis? These pictures reveal exactly what we're talking about. What is the research? Here's the research. There's a hefty correlation between abnormal posture, screen time, physical activity, and suspected scoliosis, and finally, the validity of whether we should screen or not. And most importantly is that a child should be screened. And this does not happen, unfortunately. Not in Jordan, not in Saudi Arabia, not in the UAE, not in any country that we are familiar with. Even in Europe, many countries do not screen. So now that we understand what SPOT is about and why it is important, the question is, how does it work and how can we collaborate? The flow of the program is as follows. The PE teacher will get certified. That is the first step and most important step. From that point, they will conduct the screening for children ages 9 to 15. That is according to our last conversation with our scientific team. The flagged cases will imply a letter being sent to the parents. The parents receive the letter and spine health related info, so we need to educate them a little bit as well so they don't panic. And finally, if they do not seek a medical diagnosis, then next year around, the child will be screened again and we get to see with the records we've kept if the situation has progressed. However, if the parents seek medical diagnosis, the doctor reaches and upload the diagnosis so we understand if we've reached a conclusion on this case. And if it's negative, meaning there's nothing to be concerned about at this point, is not severe, etc., they might choose in that diagnosis to say, hey, maybe you need to do some strength training. However, we're going to continue to screen year on year. But if it is positive, in this case, we can go ahead and start treatment plan, but definitely we're not going to screen it any longer. And the reason for that is because it's been diagnosed and now action must be taken. But for us in the school environment, we're going to make sure that that child is properly taken care of within the school activities. So what do we need is to certify, and then we will need an in-school screening environment. So that's a small room that we need to adjust. We will have a web application on which all of the data needs to be stored. We've implemented a scientific team, which is described in our document. And finally, a leadership team that contributes to directing how the program continues. So what are the objectives? First of all is the early detection of postural distortions, and that's for the benefit of student health. Sustainability. We want to make sure that we can manage time, cost, and ensure accuracy. And finally, we want a low percentage of false negatives or positive results over time. There is a risk that might happen, as with all screening programs, which is why it's important we collaborate, we measure, and improve over time. And finally, to make this happen, we will need to have solid KPIs to guide year-on-year improvement. And we need a joint governance team representing key stakeholders. Schools and parents must be represented to voice their concerns, opinions, and to help improve how we go about the program. The Jordan Spine Society Foundation are a part of the program already. They have signed on the scientific team, and they help direct both the curriculum and how we are going to deploy the program in the school environment. And finally, of course, FitPro Alliance, which is the implementation and design arm of the program. Others might want to join, however, they must be relevant to the program. That is the only reason why would we want to have them in the joint governance team. A little bit about us. We are an accredited health and fitness education institute. Here are some of our accreditations and the countries we are currently active in. In Jordan, we've started a coaching team with our graduates, and we have 9 coaches we work closely with and 2 training centers in Jordan, and 4 coaches and 1 training center in Palestine. And in Jordan, we collaborate with over 16 doctors, 2 physiotherapy centers, and 1 clinical nutritionist. This is the list of the doctors we currently collaborate with, and Physio One and Circle are the physio centers we collaborate with as well, and our clinical nutritionist is Hala Al Sharif. Why is this integration important? When doctors communicate with fitness professionals, we can speak the same language. It makes sense that we would then have reporting lines back to the physician so that they know how their patients evolve over time. A person's journey to health is going to have ups and downs, and so that is why it's important to have a network of professionals that communicate with one another in order to help bring the best results to life. Thank you so much for taking the time to go through the presentation. And if you have any more questions or concerns, or you see an opportunity for us to collaborate and improve on the program, please reach out at the details below. Have a great day ahead.